Welcome back to Overtime. Shares of Zoetis closed lower today after reporting Q4 earnings this morning. Meantime, Zoetis says it just got approval from the USDA for its avian flu vaccine for poultry. Joining us now for an exclusive interview is Zoetis CEO Kristin Peck, and she joins us on set. Welcome. It's great to have you here.
Thank you. It is great to be here, especially after such excellent results and the great news of our conditional licensure of our high-path avian influenza vaccine for poultry.
So I do actually want to start right there because we've seen what egg prices are doing in the midst of this bird flu. We've seen it spread to other types of animals. We've seen it spread even to some humans. We've seen it show up in the inflation data just this week. What does this vaccine mean, and how quickly can it be deployed?
Sure. I mean, what we've seen is a significant impact to the poultry industry from high-path avian influenza across the globe, but certainly in the U.S., especially in the layer population, which is driving the increase in the egg prices. We've also seen it, as you know, in dairy cattle, and it's now in humans. So it's a very One Health. We've been working with the administration and with Congress, and we're very excited today to get the licensure for it in poultry, which we think will be a tool that we will help support the government as they, deem necessary. So we'll continue to do whatever the government wants there.
How big is that opportunity in livestock, in poultry, when you think about vaccines and health? I mean, I sort of came ready to talk to you about pets, and we'll get to that as well. But when we're talking about something like avian flu, what could that opportunity mean from a market standpoint?
Given that pet care is our largest business, over 65% of our business, livestock is not as large. So we don't see it as an important, significant impact overall to the bottom line of getting that. It's really important to our customers and most importantly to our purpose to support, and nurture the world and nurture human health. So that's really much more it has to do with. It's not going to make a significant impact for us on the bottom line, but it really will support our customers as they need it.
So let's talk about cats and dogs.
Yes.
And in particular, I'm wondering demographic shifts and maybe psychographic shifts. There's been so much that the luxury consumer, the higher end consumer has been powering in this market. And you got to have a certain amount of money to do sort of medication for your pet with more advanced and serious diseases. What are you seeing trend-wise, maybe even with those pandemic pets that got purchased and the percentage of pet owners who are willing and able to provide that kind of care?
Yeah, what we're really seeing is how essential and resilient the animal healthcare industry is, and that's because of the human-animal bond. It's not just the number of pets, it's who's adopting them. And to your point on the trends, it's more millennials and Gen Z, and they see their pets as critical members of their family, and they want them to be treated with the same, health care that they get treated with. And that's what's really been driving the double-digit growth for us across key franchises, such as our OA Pain franchise, which grew in 2024 80%. As you look at our, Simparica or parasiticides franchise, growing 28% and 17% in dermatology. They're taking better care of their pets. They're much more engaged in their pet's life. And we think it's really a resilient and enduring driver of the growth for Zoetis.
Is there going to be a GLP-1 type effect for pets at some point? Not necessarily specifically that, but a life enhancement.
Well, our biggest areas of focus right now in our pipeline that we really think are going to be disruptive and game-changing is chronic kidney disease, which is going to be a $3 to $4 billion market. And we mentioned at JP Morgan that we're expecting a product there in the 12 to 36 month. That is really one where for both dogs and cats, there are no treatments in animal health approved today. Also oncology, which is where you see it in human health, which was going to be a 1.2 to 1.7 billion. What we really guided to is we're expecting an approval every year for the next several years, and these are going to be blockbuster products. And I think what's really important is these provide drivers of our growth over the short, medium, and long term.
So you have a robust pipeline. I am curious how you're navigating trade policies, especially as we're having conversation, just the latest today, and we don't know when or if or how those get implemented, but reciprocal tariffs that the president talked about this afternoon. Yours is a global business. How do you navigate it?
Yeah, so I mean, what we've done is very similar to many companies. We've had, teams working over months to be tracking some of this and to really understand what the potential implications are. It is fast moving and it's evolving. And so as we said when we gave our guidance today, we're not baking that in since we don't know when and exactly how much. But we've been doing scenario planning like many companies and, stand ready to try to help address and mitigate whatever we can.
How quickly could you move production from one country to another or stand it up in order to adapt to that?
Well, we're a highly regulated industry, and it takes, multiple years to be able to move a product. Or honestly, it's not just a product. It even could be an input. So this is a very global supply chain as you think about both human and animal pharmaceuticals.
AI, we know it's coming into drug development and research for humans. How does it play out with pets and other animals?
Well, we're really excited that we already offer AI products. I sometimes say you can get better diagnostics for your pet sometimes real time than for humans. So we already offer Imagist in the clinic. Imagist is a platform where it can take a picture of whether it's blood or fecal or urine and get you the results while you're at the vet. So you can find out whether or not you have worms or whether or not, we're talking about oncology, whether or not your cell is cancerous. So this is really a game changer. And we don't just give you that answer based on the AI. We'll connect you with a pathologist so your local vet knows how to interpret that and what the potential options are going forward. So we're really excited to have AI in the market, but we're super excited for what it can also do across R&D for our organization, in early research, in discovery, and in development, and obviously all the commercial applications as well.
Kristin Peck of Zoetis, it's great to have you here on set. Thanks for joining us.
Absolutely. Thanks for having me.